Hello, my name is Sadie Jeanette, and I will be presenting a journal article that looks at tailored health messaging in breastfeeding promotion. The name of this journal article is Parent Preferences for Text Messages Containing Infant Feeding Advice. This article looks at a study that was conducted and funded by the Texas Women University. We will be discussing the purpose of this study, the delivery, data analysis, and results, as well as future considerations and what this study has added to the literature. So first, a little bit of background. Child obesity is a global issue. There's many factors that have been identified. Several of these are breastfeeding, specifically never having been breastfed, early cessation of breastfeeding, and responsive breastfeeding practices. Responsive breastfeeding practices is feeding an infant on demand when they give cues of hunger rather than nursing on a schedule. So as technology and barriers have changed, providers have had the opportunity to utilize what's called mobile health. This delivers healthcare messaging. It is a practice that increases accessibility for many people. However, there's limited research to explore the potential of this delivery system. So the researchers really wanted to look at the participants' preferences for the frequency of messaging, whether or not the messages promoted breastfeeding practices, and whether or not the participants preferred gain or loss framed messaging. The authors also defined gain framed messaging as a positive message about breastfeeding and loss framed as a negative consequence of not breastfeeding. So the methods of this survey, the sample was a convenience sample. The parents who were chosen had babies aged 0 to 3 months, whose babies were born full term at birth. They attended a clinic at the University of North Texas. They established care at the clinic at least 3 months prior to having their baby, and they must be 18 or older, as the researchers believed that parents aged younger than 18 may be influenced by their parents' preferred feeding practices, and that would skew the data. So the survey was designed with the health belief model as the theoretical framework. The constructs of the health belief model that were included in this survey were perceived benefits of breastfeeding, perceived barriers of breastfeeding, cues to action, and self-efficacy. These constructs were giving a paired item, as in there was 2 items per construct, one being gain framed, the other being loss framed. The final construct that was measured was perceived susceptibility, and this one was framed only as gain framed. So surveys were given through a web page and a short URL. Participants could complete it in office or later. Demographic information was included in the survey, including patients' participation in welfare programs. The items asked participants how likely they were to adopt breastfeeding after each message. They were also invited to provide open-ended feedback regarding each message. The pairs of questions were divided among participants so that the 16 participants were given the gain framed messages first, and then the loss framed, and then the 18 remaining participants were given the loss framed versus the gain framed, or the loss framed first and then gain framed second. Okay, let's jump into the analysis. So a priori analysis was created and what was found is that the sample size at minimum needed to be 24 participants for the survey to have statistical power. There were 36. Researchers had a goal of 40. They believed that this would increase statistical power and give back more variable information. Variables that were collected were coded for gain framed, loss framed, and how likely the messages would affect future feeding choices. Open-ended responses were reviewed by researchers, and t-tests were performed to distinguish helpfulness between gain and loss framed questions, as well as preferred order of messages, so whether or not you received the loss framed first or the gain framed second, or vice versa. So the results indicated that just over half of respondents stated that they were more likely to adopt breastfeeding practices based on gain framed messages. 65% stated loss framed were more helpful. However, a t-test revealed that there was no statistical difference between loss and gain framed likelihood or helpfulness. When comparing between individual items that were constructed to measure health belief model constructs at self-efficacy and benefits, found overall that gain-framed messages were preferred. Most participants opted for monthly texts as well. The open-ended questions revealed several interesting new considerations for researchers. One person stated that these statements would be offensive to non-breastfeeding parents. Another said that messages implying breastfeeding had positive effects would be more beneficial. Another stated that the items portraying self-efficacy would be offensive to those who could not breastfeed. Let's see. Another participant also stated that the self-efficacy items were offensive and do not take consideration for the different feeding choices between different families. Another participant also found that a loss-framed message was too harsh. And lastly, another response stated a link to an outside resource would be helpful, so supplementing messages with outside studies or researches or articles that participants could look into the subject further. Okay, so several implications came out of this research study. It definitely adds to the literature. It was inconsistent with a lot of research on gain versus loss framed messaging, whereas in this study, they found that there was no preferred difference statistically, except, and one implication of this is that perhaps new parents are just happy to receive any kind of educational material regarding feeding practices. Another novel finding is that the preferences for frequency of deliverance of health messaging via mobile health. This is the first time the researchers indicate at the time that they wrote this article that there had ever been a measurement for this type of preference. So that's an avenue that needs to be explored when considering breastfeeding promotion and mobile health delivery. Also, the results of this study represent a pretty diverse demographic. The 30% of all participants were Spanish speaking, and over half, or excuse me, almost half received WIC. So this could be really representative of other populations, and the results can be applied to different communities. However, race and ethnicity were not actually measured as part of the survey. So there's a gap there that needs to be filled to further understand how these messages are received and whether or not they promote breastfeeding practices, especially for marginalized individuals. We know that people of color are more disadvantaged and participate less in breastfeeding practices. So further research on that avenue of mobile health delivery and breastfeeding promotion is important to reduce health inequities. Let's see. I would like to next talk about a critique and a few suggestions that I came up with from this research study. First, I found that the delivery of the survey is an issue. It's a weakness in the study because although the logic behind giving a survey through the internet makes sense when you're studying participants who are receiving text message delivered messaging, there are some things that could suggest that there's a disconnect between these two things. For example, there could be that an individual can receive text messaging but cannot access data. People with lowered income may not, may have run out of data to be able to access the internet. Also, having the survey a hard copy in office would open up the possibility for more participants rather than the barrier of providing a URL. Also, I wanted to point out that the researchers initially wrote in their introduction that they wanted to understand how these messages promoted breastfeeding. But what they ended up measuring was actually the perceived likelihood of adopting the behavior, the breastfeeding behavior, and the helpfulness of the message. Neither of these necessarily are measuring promotion of breastfeeding. You could argue that the likelihood to adopt the behavior would be intent. However, this is not explicitly stated by the researchers. So I think that that would be a definite weakness of this study, that they discussed effects of their messaging, but did not answer their initial research question. So lastly, there was a whole new avenue of research that was introduced and was not discussed by the researchers, and that was that many of the open-ended responses indicated that self-efficacy items were offensive. So there's something that really needs to be looked into as far as the psychology behind new mothers and their shame in not being able to breastfeed in a society that is promoting breastfeeding as the preferred choice. So that definitely needed to be considered in the discussion by the authors, I think. Also, one last thing, I wanted to point out that perceived susceptibility was not included in the framework of this survey, even though it is a construct in the health belief model. There is no discussion about why susceptibility is left out of the measurement items, and I think that there would be logical reasons why it should be measured in this type of survey. All right, so to conclude, as mobile health expands, as technology expands, and we grow a deeper understanding of breastfeeding as a major indicator of health, it's paramount that we understand how health messaging can be properly used to promote breastfeeding, especially to reduce those health disparities in populations most affected by the lack of breastfeeding, and to increase all-around health equity. Thank you so much for attending my presentation, watching my presentation. Here's the reference for the article if you would like to look it up yourself. I hope everyone has a great day. Thank you.